Good morning. Today is day 22 already, and it's been a few days since I've been with you. And the reason is I had the opportunity to meet with someone by telephone that has a lot of experience with lung cancer patients and is a patient advocate, and she's very knowledgeable and a patient navigator. There's either or. Anyway, she lost her father like 20 years ago to lung cancer, and since then she's worked with trying to find a cure. And she started an organization called Just Say Yes, or Say Yes to Hope. And you can go online to see what that's all about. But she was kind enough, because her husband worked with my daughter-in-law, she was kind enough to say, yes, I will talk to your mother-in-law and I will answer any questions that she has. So we had a very interesting conversation. And what I want to do is to give you some information. If you are experiencing cancer, or you experience cancer in the future, or whatever, there's some questions you really need to ask right from the get-go, and so that you have control of what's going on, and you're letting them know that you are very interested in your therapy and what's going on. So the first question you need to ask is your oncologist, like mine, should be a lung cancer specialist? If not, you need to find one that is for lung cancer, but it could be breast cancer. It could be any other kind of cancer. Are they a specialist? An oncologist is not enough. They're like general practitioners, I guess. I don't know. Anyway, the other thing you need to ask is, and this is usually one of the first things that they test for, is do I have a biomarker or a high PDL1? And what happens then is, if you have a biomarker, they can target that particular cancer with the particular drugs, and it is a better result. So anyway, the other thing she really talked about, and I think this is very critical, and I believe that places like Mass General or Mayo Clinic have these kind of things in place because they work with so many cancer patients, but you should ask for a patient advocate and a patient navigator, which navigates you through all the different things that are happening to you. And your team should consist of, it should be an integrative team, so they should consist of a team dietitian, palliative care, fit massage, physical therapy, nutritionist, and on it goes. There's a lot of them. And a person really needs all these different things as you're going through your particular therapy that is being prescribed for you. And I also asked about immunotherapy, and she said, well, that's like a vaccine, and it trains your body to fight cancer, and it doesn't harm your normal cells. And that's usually after you've received chemo and radiation and whatever else, okay? So anyway, and of course, there's always clinical trials, out there for you to take advantage of. So anyway, for myself, I asked her about the drugs that they said that they were going to use, and what I was told was that it would be small amounts, you won't have a lot of side effects, et cetera, et cetera. So anyway, so I asked her about that, and I gave her the drug names, and she said they are very aggressive drugs that they're using. And I'm sure it is when you think about it, because here my cancer is 3B. It's in my lymph nodes, and if they're going to reduce the size or get rid of it in my lymph nodes, whatever, in order to do something else, then that has to be aggressive. So I'm looking at, if I choose to go that route, I'm looking at probably some pretty serious side effects, and so on and so forth. So anyway, so it's all up in the air for me at this point. I'm still making a decision. Today I meet with my radiation oncologist, and so believe me, I have a few questions for them. There's different therapies that they can use depending on what they decide my cancer really is. And so there's like proton therapies, the escopal effect, there's a cyberknife radiation surgery. Who knows? I mean, can any of these be used on me or not? So I'm kind of excited about this appointment because I feel like I'm going into this appointment prepared. I think it's really hard to be prepared. You get the word of, you get your diagnosis and you're kind of surprised, because at least myself, I was thinking, well, this is caught early, this is stage 1, they'll take the upper half of my lung and I'm done. It's over. Done, cured, fixed, whatever. Well, that isn't what happened. So now I got to rethink the whole process. And it's really hard to come to an understanding of what's going on exactly, and you don't get enough information, and it's hard to ask the questions just out of the blue. And I know myself, when I saw the oncologist the first time and gave me my diagnosis, I would have really appreciated had he had a piece of paper that said to me, okay, this is option 1, this is option 2, this is option 3, this is what we are looking at. And this is why this one's good, this is why this one's good. If he would have just given me the paper with the options so I could have actually physically looked at them, would have been so helpful, because as it is, you're just taking in this information with your ears and you're trying to process it, and you can't do it in 5 minutes or the half hour that they give you or whatever. Okay. So anyway, so that's where I'm coming from. Today I've got lots of thinking to do, praying to do, figuring this out, and so on and so forth. But I want to leave you with something kind of fun, at least one thing that's fun. My husband and I, the other day, we went to the Mall of New Hampshire, the mall, I should say, to walk, because it was just one of those kind of days. And it wasn't nice to be outside, so therefore we walk in the mall. So we're walking around, and we go past, every time we go past, what the heck is the name of it? The Cinnabon place, right? Well, this was the first day. I said, you know what? I'm going to go buy one. And Harry says, yeah, get one and we'll split it. I thought to myself, are you kidding? No way are we splitting a Cinnabon. So we bought one for each of us. And we go home, and oh my God, it was just like heaven, I love bread, and I especially love cinnamon rolls. They are my favorite. I prefer caramel, but I will take it with frosting. It's just fine. So I was eating that, and I was just savoring the flavor. It was so delicious, and I was just like enjoying every bite. And so anyway, that was what was going on in my day. But what I really loved, I loved the message on the boxes. First of all, before you open it, it says, life needs frosting. And I certainly agree with that. That's a good idea. And then you open it, it says, your day just got a little sweeter. So today, I'd like to challenge you to go ahead, make your day just a little sweeter in whatever way works for you. But be sure you savor the moment, because that is the very best part. Now, I don't have to go to Cinnabon for at least 5 more years. I think it was probably 10 years since the last time I'd been to one. But just being able to savor that flavor made it worthwhile. You guys have a great day. Bye.